The entry of the 2010 Patient Protection and Affordable Care Act, PPACA, in the United States put the issues of medical services change and medical care costs back in the public spotlight. DeVoe and partners recently assessed that the expense of a family health care coverage charge would rise to the middle family pay constantly 2025. A stoppage in medical care spending attached to the new financial slump and the entry of the PPACA happened after this model was distributed. In this refreshed model, we gauge that this limit will be crossed in 2033, and under positive suppositions the PPACA might stretch out this date just to 2037. Proceeding to roll out gradual improvements in U.S. wellbeing strategy will probably not twist the expense bend, which has evaded arrangement producers for the beyond 50 years. Confidential medical coverage will turn out to be progressively exorbitant to load to center pay Americans except if significant changes are made in the U.S. medical services framework. Medical services expansion eased back during the oversaw care time of the last part of the 1990s. However, it rose pointedly after the public reaction against oversaw care made numerous businesses leave that model. The sharp expansion in medical coverage expense expansion that began around 1999 was combined with declining expansion in family livelihoods. This crisscross in rate patterns is shown in Figure 1. As has generally been the situation when well-being change approaches are being bantered by the United States Congress, the yearly pace of expansion for medical coverage charges in 2009 to 2010 eased back to the least level since the late 1990s. Despite this easing back, the yearly expansion pace of healthcare coverage expenses actually outperformed U.S. family profit, which deteriorated from 2008 to 2011 and remembered an outright decrease for normal family pay from $50,300 in 2008. The PPACA held together a protection-based funding framework in which the insurance agency that mediate cases and give some consideration observing and oversight are isolated from the substances that convey the consideration, like doctors, clinics, and auxiliary administrations. It safeguarded the independence of private guarantors to set rates and to decide cost-sharing sums, deductibles, co-installments, and lifetime limits. In 2005, DeVoe et al. Featured the bungle between rising medical coverage costs and stale family profit by projecting that a family health care coverage expense would rise to the typical U.S. family's pay continuously 2025. Given that these 2005 projections might have caught the period when charge rates and family profit were most lopsided, the entry of the PPACA, and the new easing back of health care coverage and compensation increments, we refreshed this projection. Utilizing techniques like those utilized by DeVoe et al. With information from the Medical Expenditure Panel Survey, MEPS 8 and the U.S. Census Bureau, 4,9 we fostered a refreshed model of insurance payment cost and family pay projections. The model introduced in Figure 2 incorporates real charges and pay figures from 2000 to 2009 and extended patterns from 2010 to 2040. From 2000 to 2009, the normal yearly expansion in insurance payments was 8.0%, family salaries rose a normal of 2.1%. If medical coverage charges and public wages keep on developing at late rates and the U.S. wellbeing framework makes no major underlying changes, the typical expense of a family health care coverage expense will rise to half of the family pay continuously 2021, and outperform the typical family pay constantly 2033. If personal expenses are added to the superior expenses, the half limit is crossed by 2018 and surpasses family pay by 2030. Anyways, thank you for watching this video. Don't forget to like and subscribe, and see you on the next video.